For a month I was in a coma. I nearly died. They were going to withdraw care twice and my family said goodbye to me twice. And when I came round, my hands and feet were black because of the sepsis and they had to be amputated. I developed a chest infection from the COVID. That chest infection turned into pneumonia and that pneumonia turned into sepsis. I was fit and active. We used to go off walking in the holidays and then suddenly I've got no hands, no feet. It's been very difficult. Of course it has. I'd be a fool to say anything else. It's very frustrating to want to pick something up and not be able to. I'm having to learn to walk again, having to learn to use stumps instead of hands, but probably happier than I have been for a long time. There have been lots of pleasures along the way, but they're pleasures of a new life when I might have been dead. I had very, very mild asthma and I got really sick with it. I'm under 60, I was fit, I was walking and I got to close of death, and there are lots of people who've died. It is a serious illness, and if it's not serious for you, it might be serious for the old person who lives next door, or your mum, or your grandma. People say, oh, it wasn't COVID that did this to you, it was sepsis. I wouldn't have got sepsis at this point if I hadn't had COVID. It was a direct consequence. I've had one life and now I'm going into a second life. My first life was good. My second life is also going to be good. It's going to be different, but it's going to be good.
Your talent and abilities will improve. For that, you have to start, says Martin Luther King. Enjoy the miracles of every beautiful morning and let them fill your heart with joy. A very beautiful morning to one and all. I am Arun, intern, Sri Sairam Homeopathy Medical College and Research Center, will be hosting today's session along with my colleagues, Dr. Ashita and Dr. Karthikeyan. As I always believe, time is tissue. I warmly welcome one and all who are here to spend their valuable time in today's webinar conducted by Department of Organ of Medicine and Homeopathic Philosophy on the topic Choice of Potency, Homeopathic Perspective of Different Scales of Potency, Mridul's Experience. Before moving on to the session, I welcome the man behind this saying, if you cannot, then who can? Yes, we all guessed it right. I request our ever-encouraging Principal Sir, Professor Dr. P. Chairman Sir, HOD, Department of Organ of Medicine and Homeopathic Philosophy, Sri Sairam Homeopathic Medical College and Research Center, to give the welcome address. Over to you, sir.
Good morning, one and all. First of all, I am very much thankful to God Almighty and our Chairman Sir Leo Muthu and my dear parents for giving this opportunity for me to stand the principal of Sri Sairam Homeopathic Medical College and Research Center. Actually, during the lockdown, we have conducted many webinars and seminars, but this is a special day which we conduct with the legend of our homeopathy physician and our senior Dr. Sagani sir. Because it is not possible to explain about the Sagani sir in one or two words, because he is a good teacher as well as a good administrator as well as a good doctor. He is a good teacher. Teachers takes a hand, open your mind and touches the heart. So Sagani sir is like that person, a man of homeopathy. So frequently we called him for the webinar. So last year also sir beautifully taken that seminar regarding his own way of treating, that he followed his father's view. So this time just I thought, what is the topic which we given? Because it is sir is not a simple person to give the topic. So only I thought, because various potencies are there, we already know about the term. So the decimal scale is there, centesimal scale is there, heptadecimal scale is there. Some of the persons are using the mother teachers. So we are in the confusion which potency is suitable for which person. So just I asked, discuss with the sir regarding the topic, and the sir told, okay, no problem. Then I told sir, this clearly you just explain your experience, because sir is also he is a chief person and the chairman of the Central Council of Homeopathy uh, in the education committee. So at the time, he just shows various modifications regarding the benefit of the patients, benefit of the students, and benefit of the colleges. So he is a man, and also he is a friendly student to teachers and friendly as the doctors. So a man of elegance, a man of simplicity, and a man of humble. So in this occasion, a warm welcome to sir for our college as a chief guest, and also a warm welcome to our Sai Prakash Leo Muthu sir, that is the chairman of the Sairam Group of Institution, our CBO Sadish sir, and teaching, my beloved teaching, non-teaching, and medical officers of our college, and interns. The last but not least, my dear students, you are all are welcome to the session. Please, just you post your, when sir is, that is, it is the best time for you to learn about that view, that is for potencies and other things. So I kindly request you to clear all your doubt after the session of the sir. And also I am very much thankful to Dr. Jerin sir for arranging this session as usual. And also I am very much welcome to Dr. Arun, Hashida, and Karthikeyan interns for this session. So once again, I am giving a warm welcome to one and all. Thank you. Thank you very much.
Thank you, sir. For further proceedings, I hand over the session to Dr. Ashita. Over to you, Ashita.
Thank you, Dr. Arun. Speaker, Professor Dr. M.K. Sahani, sir. There are people who believe either in philosophy or in materialism. It is very difficult to keep a harmony and tempo between the both. Dr. M.K. Sahani, sir, is one who maintains both the spiritualism and materialism balanced. He, born in 17 September to a researcher and discoverer, freedom fighter Dr. Bandhu Sahani. He done his DHMS and started practicing under his father's guidance. He joined as lecturer at Bihar Homeopathic Medical College and Hospital, completed his MD Homeopathy and also PhD in Homeopathy. Teaching and spreading the knowledge is passion for him. He is the editor of popular magazine Homeotharang in Hindi and Journal of Homeotransmission. He has been as founder, chairman, MD for Sahani Research Institute of Drug Transmission and Homeopathy at Patna. He has been as elected as CCH member in 1990 and also formulated curriculum and education regulation in homeopathy. His contributions were so much that one intro session is not sufficient. So I directly call out Dr. Sahani sir to share his valuable experience on most expected and challenging topic of today's scenario. Please, sir. Over to you, Sahani sir.
Thank you very much. Thank you very much for this nice introduction. I am very always glad to see the people at Sairam Institute of Homeopathy and the entire big arena of the educational arena. I say educational arena, and I had several opportunity to meet and visit that places, and always I learned something new from this place. So, and it is definitely a very inspiring institution for all of us, and I hope that it will continue serving everywhere under the able guidance of our principal, Dr. Chairman, and all others associated. They are working like a teamwork and the family members so that this institution has flourished like that. And I also see the students are very much enthusiastic about learning. And this is the only things that is required for students to build a confident practitioners in their life. Practicing is very important, and after all the educations are has to be aimed at development of the skills. And this skill development program it always has to be supported by a continued medical education, and I'm glad that Sai Ram Institute is conducting regular uh, CME programs and inviting all the some people from outside and inside their own faculties, and it is definitely a very learning opportunity for all the students participate. They are benefited with the different, and I think during this pandemic session, this webinar has came as a boon, as a something rewarding for the educational system, where we can learn offline also, online also, and every time, even in the emergency and the urgent situations. So with these words, I thank you all, and I am glad to be again with you, to see the smiling faces, all the enthusiastic faces, all the affectionate faces are here before me, and you are always instilled in my heart. And it is my blessings for all of you, so that these institutions can flourish to become a most wonderful ashram, the educational hub for the homeopathy in the future and all the times. Thank you very much. Now, I have to start my presentations now.
Yes, sir. Yes, sir.
Just I am uploading my Power PPT, and we shall continue with that.
Yes, sir. Please, sir.
Yeah. So, good afternoon, friends. The topic that we discussed with Dr. Principal Sir, Chairman Sir, to have a choice of the potency. When I was thinking about the choice of the potency, and it gives a very inspiring thoughts for all of us. Whenever you think of the potency, just try to imagine the status of your life. How much potency you have. How much potency you have. This is very important thoughts that we have to have an introspection in your mind, to analyze yourself, your potentiality, your own potentiality is the ability to receive the substance, anything from the outside. And without this potentiality, without this ability, without this strength, so potency is the strength of the life. And with this strength power, sometimes it is weakened by the dynamic powers. The potency represents the dynamicity. It is the dynamicity of the life that is very much important for all of us. So let us start and see this potency, the aspect of the potency, aspect of the potentiality of the life, the power that we have within ourselves, and the power that we require from outside as a support, power from the outside, the external power coming from the medicines. This is, and all those remedial aspects, it has to be powerful. It has to be effectiveness. So how we see the power, this is very much important. And how we take them and how we receive them, all these aspects are very important. Recently, I was going through a very good literature about the Benevestos research, where he has explained and where he has mentioned about the potentiality of the human life. And it has the potentiality to reach beyond the planet, beyond the universe. So this is the dynamicity which has been experienced even by our master, Dr. Henneman. So friends, let me continue with these small introductions about the topic, about this potency. So I am just starting the power. So it is the homeopathic perspective on different scale of potency. Now the scale is very important because you must have the measurement, because for prescribing, for the technical purpose, for the practical purpose, you must be aware what is your scale of the life and what is the scale of the medicines, and both has to be matching. The simillimum. The simillimum is not only with the symptoms. Simillimum is not only what you see. Simillimum has to be at every level of the life, simillimum at the dynamic level, simillimum at the mental level, and simillimum at the physical level. And besides this, you have the dynamicity, the aspect, the potentiality of your mind, potentiality of your vital principle, and potentiality of your the medicines. How much potential you have, and and this depends on the way you think about the about your thinking. If you are materialistic in nature, if you believe only in the earthly matters, and then you will not be able to perceive the idea about the homeopathic potency. And you have to move away from the this materialism. You have to go to the spiritualism, higher power level of the life. Spiritualism, this is the only aspect where you can have a better understanding about the potency. We have the different choice, we have the different scales, we have the different potency, all available. And if you are concentrating only on the materialistic aspect, you will always remain confused with the potency. Which potency to apply, where and how? This is very pertaining questions that you being used to ask by several of the students to us. And these questions come only because their ignorance of the spirituality and the dynamicity. If you have a faith and confidence in the dynamicity and the spirituality of the life, you can understand, very well understand the importance of the potency in the life. And if the question will not arise, which potency? Only the suitable potency, only the simillimum potency. And if you have the simillimum, you understand the status of your life, where you are, how much depressed you are, and how much elevated your energy, elevated you have. If you have the higher energy plane, you will require the higher energy medicines. If you have the lower energy plane, you definitely will require the lower energy plane. So with this, it is very important to understand about these things. The faculty of the capacity. Power, what is the power? Power is the faculty or capacity to act, the strength and potency to accomplish something. And what we actually mean about the power, that it can help us to act, to become in motion, to have become dynamic. So life means what? Life is simply the dynamicity. Life is simply your action. And as long as you are alive, you have the life, you say that you can move, you have the motion within. And the moment this motion goes away, you are a most powerless man, most helpless man. So the motion is dependent on the power, and the power is the expressions of your potentiality of your life. So this is very wonderful explanations about the potency that I got from George Bernard Shaw. Then potency is the poem. That means it has to be, the poem means what? What you will think about the poem. Poem is the unified words. We are unifying the words, and these unified words are the potency. If your life is, your entire plane of the life, mind, body, and spirit, they remain tuned together. They remain in a continuity, in coordinations with each other. Definitely, it is going to be a big poem, big song. It is the song of the life. It is the poem of the life. It is just the music of the life. So tuning life with most potential medicines. Our topic is for tuning this life with the most potential medicines. The medicines which is most potential and simillimum to the, so making a music, creating a music out of the combine when the medicines combines with the human life, it becomes, the music has to be created, and that music will give you the beautiful soothing effect on your life. Friends, the Krishna, our Lord Krishna, he had made a very beautiful example that even the small rat And the power of this small rat, a squeaking rat, into the insignificant roaring lion. This has the capacity, the small rat has the capacity to become roar like lion. So how you see that, and you see our Lord Ganesha, and who is the vehicle for, who is the carrier for the Lord Ganesha? The small rat. Just imagine what significant power that small things have got. And definitely our homeopathic medicines. When you look into the homeopathic medicines, and when you look at the birth of your life, from a small seed, from a small tiny seeds, the big tree can be created. From the tiny sperm, which is invisible, the human life is created. So this is the power of the minuteness. This is the power of the smallness, and this is the power where it is the beginning. It is the stage where the life has to begin. Life has to begin. So everything starts with the small. Everything starts with the small to become the big. It is not that we are born like this. We have born. We started our journey of the life like a small, helpless creature, and now we have become the most sensible, powerful, and we feel ourselves to be the worthy man. Friends, and what we see before we go into the homeopathic aspects, we have to see what are the bedrock of homeopathy. Definitely, case taking, your data receiving, you must have to be aware about the right subject that you can be aware. Don't have the imaginations. Just the practical aspect of the life of the medicines is that you have to build a correlations of the, you have to investigate the case taking, data receiving. You have to collect all the information from the patients that is coming from his past, his present, and his surroundings, the environment, from where he is born, what was his from which community he belongs, and what was his past, his ancestors. So these all these things are belongs to the case taking, because we have to analyze. We have to analyze the potentiality of that man, potentiality of that patient. Then after receiving all data, we have to analyze them, and we have to find out, select the symptoms. That is called the analysis of the data. And analysis of the data only gives you the information about the potency. Analysis, after analyzing the data, you comes to know, you become aware about what is the status of the life, and what is type, and what are its potentiality, and how much potency is required. How much potency is required? This information you can get only after you have properly analyzed your data. Then you have to combine those data, combine those informations to synthesize a portrait of the human being, the man seated before you. The man seated before you is a big portrait. He's a good thing, and how he has been created, and that is the real estate. So only by looking at the present portrait, you cannot make a good information. You have to go inside. You have to go inside. The insight in the human life comes not from his external presentations, but we have to make explorations inside into the life, and that is the process of the case taking. And then thereafter, where you analyze and you get a natural portrait of the human life. See, portrait of the totality renders quintessence. That means the totality. What we say, the totality of the symptoms. What the totality of the symptoms? It is the interpreted aspect, the idea, the concept that you have built, created in your mind with the ideas, concepts, imaginations, and fantasies that is required to multifarious dimension of the totality. You have to analyze, you have to find it out, the relevance, you have to make a comparison, and then thereafter you have the interpretations of the information received. So, and this is called the portrait, which reflects you the essence of the symptoms. The portrait reflects, and this is called the totality of the symptoms, or you say the portrait that has to reflect all essence of all the symptoms present in that person's, then inner environment and outer reflections and potential strength. So this is the methodology. This is the process which we have to follow to get into the process of the life. Getting into the process of the life, this is very much important. Now, this is the unified state of the totality. Representations through the totality of the symptoms. So see, the totality is the word. It is not only word, it is the essence of the symptoms that you have build up within your mind, the concept that you have perceived within your mind, and that is the potential strength of the vitality. So it is the unity of the, and it has to include the mind, body, and the spirit. Friends, essential feature of the medicines to act on the patients. How the medicines has to act. How the medicines, it must have some idea. That means the action that has to be changed, and it has to be thought of. So the essential feature is the actions that you have to bring a change so that you get the result. And these actions, for these actions, you require symptoms of intensity. What is the intensity of each symptom? What is the depth of each symptom? And what is the depth of the vitality? Suppose a patient comes to you and say, "Doctor, I have a pain in my head." Don't get satisfied. Are you satisfied with this? No. No. You have to say, where is the pain? Which part it is getting the pain? It is coming from the inside. It is like peering pain. It is coming from the vital power. It is associated with the mind and the spirituality is disturbing whole of my life. It is disturbing whole of my life. And that means the intensity of the symptoms and the depth where it is, from where it arises. That means the origin place of that symptom and depth of the vitality, how much it has affected your strength. Are you feeling weak after the headache? Are you feeling energetic, or you are not affected? So all these aspects constitute the essential feature of the medicine. And medicine, even if you have selected right medicines, it will not work until you have selected the proper potency. Until you have selected the proper potency. So action, change, and things are the ASTT process has to be followed for the understanding the action of the remedy. Selected medicines has to be similar in symptoms and higher in strength. And this is very much important. Dr. Kahneman has mentioned in Organon 27, point number 27. The curative power of medicines, therefore, depends on their symptoms similar to the disease, but superior to its extent. It has to be superior, it has to be on the higher side, so that each individual case of disease is most surely, radically, and rapidly and permanently annihilated and removed only by a medicine capable of producing in a human system in the most similar and complete manner the totality, which at the same time is stronger than the disease. Mind it, is stronger than the disease. When you apply a stronger power on the weaker power, it will simply remove the weaker dynamic force is always extinguished by the stronger dynamic force. And this is the theme, gist of the. So to understand the level of the potency, it must have to be superior to your human life, a strength of that individuality. So similar to the disease, but similar but superior in its strength. This is the idea that I conceived from organ foreign number 27. And then energy level of the life are very valuable with the life situations. Our energy of the everything is energy, and that's all there is to match the frequency of the reality you want, and you cannot help but get that reality. It can be no other way. This is not philosophy, this is called physics. The homeopathy is not the philosophy. And if you, as long as you think it is philosophy, it is only at the mind level. No, it is at the practical level of the physics. The physics of the life. Physics of the life. The famous quote from Albert Einstein. And during healthy state, energy are free flowing. During a state, you are very free flowing. And during disease conditions, the energy gets reduced. And prescribing has to be done just above the level of the energy. And potentized medicines are just a energy-packed healing property. Energy-packed healing property. So our potentized medicines that you see, you don't see that it is the material, something is there, no quantity is there, only there is the quality, only there is the energy. So our potent medicines is the storehouse of the potency, a storehouse of the energy. And each small vials that you see, they contain the vast level of the energy. So we don't say your medicines to be the medicines, you say the energy medicines. We have to potentized medicines, the energy packed healing property. So this is the good things that I have conceived about the potency of the medicines. Energy packed healing property. And the potency only breaks the inertia. You have heard about the inertia, Newton's law. Inertia of motion and inertia of the rest. So inertia of the rest has to be broken and converted into the motion. So strength of the man of the disease and ability of the medicines will always be able to breaking the inertia, the stable conditions that has been created by the disease, the obstacles that has been put inside into the human life, the break that has been done by the disease for the further progress of the life. This break can be removed by the ability of the medicines, and that means the capacity of the medicines, and that means the potentiality, the higher potentiality of that medicines. So selection of potency has all along been a burning topic problem in homeopathy. Yes, right from the beginning until today, we are buried and worried with this problem. Why? Only because of misunderstanding and confusion that is prevailing about the real applications of the homeopathy and the real meaning of the homeopathy. To fulfill the highest ideal of cure, not only the selection of medicines must be correct, its potency and dose must also be accurate. So this confusion, if you come out from this confusion, the choice of the potency will become very simple. The choice of the potency will definitely become very simple. So friends, I'm just going to now entering into the homeopathic arena. What our masters felt and how the other followers felt, and then we will go proceed for the other systems. So what our master Hahnemann spoke about the potency. See, first they started to employ the similar medicines around 1790, and 8 years after he began experimentation with the gradual. So in 1970, he was using only the similar medicines like that of the other in a crude substance. Thereafter, he started experimentations with gradually reductions in the dosage. And he became satisfied with the physicians, the result of using dynamized medicines continued using the potentized medicines till the end of his life. You see the history of the development of the potency, which started from the decimal scale, centesimal scale, and today we have the 50 millesimal scale. And it is believed that higher potency were first prepared by Groskopf in 1834, but came in popular use with Jensen high potency after 1844. So it is a long journey that we have arrived at. It is not the decimal is not the ultimate. Centesimal is not the ultimate. And the Hahnemann has gone beyond the centesimal, and he has reached to the level of the 50 millesimal. And during his lifetime itself, he has been using the 50 millesimal potency, and that potency where nowadays we are using much higher potency than the Hahnemann's potency also. So posology in homeopathy means the doctrine of dosage of medicines. A homeopathic remedy means the quality and potency quality for course of the treatment. This is the meaning. And there are definitely till date we have the 3 scales, and they are the centesimal scale which was evolved by Dr. Hahnemann, and then later on a decimal scale was also added by Dr. Herring, and thereafter in 6th edition of the Organon, Dr. Hahnemann came out again with the 50 millesimal scale of the potency, which is also known as the LM scale. And it is, he initially called it the Q potency. Q means quinquentia millesimal potency. Quinquentia means have a very wave-like potency which can move in a very dynamic way. So he wanted to create a dynamicity. The idea was to create a dynamicity, the quinquential, the following a musical wave, unifying, and that is called the Q potency. So now a Q potency that we popularly known as the 50 millesimal potency or LM scale is now gradually evolved, and many of the homeopathic practitioners are now using this Q potency or the LM potency. So potency are broadly classified. It has been into the low, medium, and the high. Low potency designates anything from mother tincture to the 12C, and medium potency from 12C to 200C, and higher potency from 200C to upward. That means mother tincture to 12C. 12C means the low potency means it has got the material, some amount of the material, substance, the original substance of the medicine. And after 12C, all the materials are gone, and there remains only the energy. There remains only the energy. So it is up to 12 potency, they are within the Avogadro number, and after 12C potency, they crosses the Avogadro number, and so they become, and still going higher, and during nowadays we are also using 1M potency, 10M potency, CM potency. So DM, DMM, and DMM. So low, it is moving from low, medium to the high. Low, medium to the high. Low is the level where you have the visibility. Medium is the level where you have some blurred vision, and high is the level which is invisible but higher in power. Low means visible means you cannot make an estimate about the power. Medium means you can make some guess about the power, and higher means you have the confidence in the power. So low, medium, and high. This is the idea that I have perceived about the scale of the low, medium, and the high scale of the potency. Friends, now I am going into the timeline, how the potency developed with the introductions. Hahnemann started to conduct the very first experiment with dose reductions in the year 1798. And in 1979, Hahnemann began to reduce the dose and further using 5x, 6x, C, 3C, and 8x. Now, see here, x represents the decimal. So sometimes it is said that Herring introduced the decimal scale, but Henneman himself has also used the decimal scale. But credit goes to Herring only because he was using only the decimal scale. Then in 1800, he began to use the 10x, and in 1803, 12C appeared for the very first time. 12C potency. Then in 1805, the 18th centesimal dilution appears, which was to prove one of the most consistently favorite potency that he used throughout his longer career. And in 1816, 30C makes it the first appearance, and this remained his most extensively used and most highly recommended potency of all the time. And the present day confusion is that Dr. Henneman has recommended only 30 potency, so I should not go beyond 30 potency. But Henneman was not like that. He has traveled beyond the 30 potency, and he has many of the followers and many of the stalwarts nowadays, I have seen them using only 30 potency and not using beyond that. Why? Because they believed in this idea of Henneman in 1860. But later on, they have not well versed about the higher potency, so they are not using it. Further development includes the first mention of 6C in 1819, the first mention of 60C in 1824. And in 1830, he first mentioned of olfactions. Now he sees the diversion of the thoughts in applied aspect of the medicines. Now in 1824, he prepared the 60C potency. And after that, he thought that how to apply this 60C. The only answer came, the medicines can be olfacted, it can be inserted into the life through the smelling only. Or he also said it can be applied on the, if you go into the file number 283, you can see this aspect of the olfactions, the using olfactions administrations, and very popular system, which I still today found many of the homeopathic practitioners are using the olfactions, not giving medicines orally, but only by smelling. And finally, in 1838, it is very late development, the LM potency came out at the first appearance, and it is only written in 6th edition of the Organ and Medicines. And towards the end of his life, he was moving more and more toward using the LM potency, but still gave centesimal potency to measure of the potency. Why? The two parallel potency were going on, because his experimentation and final experimentation was the LM potency, but at that point he was also using the centesimal potency. So there are the references that he was using the LM potency and the centesimal potency. So this idea is very important for us to understand why, and we should not feel that Henneman said this or that only. Henneman was a progressive mind. The mind was progressing, and it was moving towards the ultimate end of the potency. So it split. Now it has become a potentized remedy versus crude remedy. And even during the lifetime of Henneman, there was a split among the homeopaths. Now same section of the belief, no. This Henneman's idea I don't believe. And still today we have so much controversial idea about the, but this idea of the split started only during the Henneman's time also. And somewhere in favor of using only the mother tincture, somewhere and they were not using higher potency or any potentizer. They were only using the initial idea, the very crude idea of Dr. Henneman, but they never thought of. So there is a split of the concept. That's why there are the concepts. There are some practitioners who say that I use only low potency. Some practitioners say that no, I use only medium potency, and some will say that I use only high potency. So this diversity is only because you have kept your mind closed. But if you can keep your mind open, you can know better which the applicability, the practical applicability of these medicines. You will know when to use the high potency, when you use to the low potency, and so you have to be flexible. Don't have to be fixed idea. You don't have to get it split. You have to unify all the three potency so that and keep into mind and use them accordingly. So Bonnigesson was clearly in favor of the high potency. He wrote many papers in support of the high potency, and he listed many advantages. He said the sphere of action continually enlarges with the high potency. So in chronic elements, they hasten the cure. The cure becomes fast. Then in acute disease, the effect appears more quicker. High potency, acute disease. And I also have seen the importance of the high potency in the acute cases. And they act in spite of discretion in the diet. Many people say that you don't eat or that things, no sour things, no smoke or other things. So this discretion of the diet is prevailing in our society. And so a section of the society feels that the homeopathy is not useful for the big people, adult. It is useful only for the children. No offense. It is useful for because homeopathy, higher potency, it is not disturbed by any discretion in the. There is no relationship of the potency with the diet. Friends, so opinion, some more opinion are there for the low, medium and high. Ellen, Richard Hughes, Wilson, Dr. Henry Dearborn, Dr. Clark, Dr. George Royal, Boric, Pierce, and in low potency. They were the low potency cases. And Bonnigesson, Herring, Lippe, Guernsey, Raw, Dunham, SCL, Kane, Bogan, Robert were in favor of the medium and the high potency. And Bell, Berneville, Borland, Stuart, Close, Curie, Dewey, then Gross, Finke, Swan, Skinner, Jensen, Ghost, Gravel, Hubbard, Sir John Ware, Margaret Taylor, Pulford, and Templeton, and Engling, Waffer Smith, P.P. Wells, and Pierre Smith used the higher potency with great success. So these are some of the history that can make your mind how much fraternity were divided with the practice of the potency. Then homeopath of the present era. What about the present era? The favor of using the higher potency. You just think about the Dr. George Withelkos. You must think about the Rajan Sankaran using which potency. John Skeleton, Prafullo Vichakar, Bill Gray, Robin Murphy, Alphonse Buchan, Visles Jekas, Massimo Mangalore, Banerjee, and then Anne Skede, Luke D. Seppers, Andre Sane, Ellen Newman, and J.S. Shah, Jeremy Says, Tynes Smith, and Springer and Alger Tremler are in favor of they are the present era, they are the stalwarts in the present era, and they are using the high potency. Then Boger, Borland and Clark. Boger practice was very important because we have to see the Boger, he was a clinician, great practical man, and he utilized all potency, not only one, but was in favor of very high potency. He utilized lower scale also, but he was in favor was the higher potency to have being a single dose of the DMM, CM potency. Then Borland say using low potency for local conditions, and he was of opinion that organ or tissue requires low potency and advanced pathology condition and sensitive cases. When there is general similarity in addition to local indications, medium or high potency may be preferred. He also says the more acute the disease, the higher the potency. More acute the disease, and this is also there in the organon of medicine. Clark say that for ordinary practice with acute illness, the low dilution from 1C to 3C will be most useful, and for chronic illness, the higher dilutions will be required. So these are the diversity among the clinicians of those areas. Boger, Borland, and Clark were a great clinicians also. So they were making practical use of the potency. So they have their own experiences and opinions. And there is important, you might have heard about the Edgar and Gentry. Edgar treated cases successfully for 25 years with the low dilutions and the mother tincture. And Gentry was of opinion that progressive disease such as fever and contagious remedy must be given in the low or the medium or the low potency. So Gentry, you might have heard about his 6-volume repertory, concordance repertory. He was very much particular about the homeopathy, but he was using only the low potency. So there are many more. John Ware, Robert, E.B. Nash. John Ware, in his 35-year experience, used low potency for physical illness, external conditions, skin disease, and fundamentally he favored for the higher potency. And then Robert advised that if it is symptoms are very similar, we can go as high as we wish, as high as we wish. The less sure we are about the similarity, when we don't are sure about what should be the similarity, the low or potency will be useful. As a rule, when there is pathology, medium or high potency may be dangerous. And Nash strongly favor for the medium and high potency. And Blackie, he said that cases of real organic changes due to the infective causes, a higher potency might clear them off. So these are some of the experiences of the stars. Pulford, very important information. Low potency simply allay the predispositions, palliations or suppressions. The low curative remedy range from 30x to cc, that means 200 potency, especially for acute conditions which do not rely on nor are part of the deep chronic malady. The medium curative remedy range from cc to 10 m potency in subacute case, all of which rest upon to some deeper dyscrasia. The higher potency range from 10 m for the chronic curable cases. And then again, Stuart Chloe, very important. You might have read his philosophy. The greater the characteristic symptoms of the drug in the case, the greater the susceptibility to the remedy. Higher the susceptibility, higher the potency. This is the idea. A, higher the medium and higher potency for the children. Medium and higher potency for the children, and higher potency for the sensitive and intelligent persons. Sensitive persons who are insensitive, intelligent, the higher potency can be used. And high potency for persons of intellectual or sedentary occupations, those who are working in the offices, seated for long place. So they need high potency so that their excitements can be exposed. And in terminal cases, those patients who are very serious and bedside prescribing, even the crude drug may be required. So he also writes different potency acts differently in different cases and individual at different time under the different conditions. And all may be needed. No one potency, high potency or low potency will meet the requirement of all cases all the time. So he made a very big analysis of the potency that being used. In his Genius of Homeopathy, that he has written this great idea of the different scales that he has experienced. So we have the patients coming to us are from the different sector. Some will require the whole, some for low potency, some will require the high potency, and some will require the medium potency. So, and then another information is Dr. Curie. Acute disease, the low dilutions are to be preferred, but in chronic disease, the higher dilutions promises the great success. Friends, Grovel's idea is very important because his idea are based on the use of the constitutions that he gave about the carbon and nitrogen, and three constitutional aspects are there. If we have to act on single part, he says, if we have to act on single part against single qualitative cause, we had better to use the low dilutions as in hemorrhage before or after the childbirth. Then with high potency, symptoms passes away quietly, leaving no trace. That means that high potency are always curative. And in dealing with the change of process of reductions or oxidation, vice versa, we must use the low potency. But to dissolve process of retention, when there is the things is retained, high potency are indicated. And nutritive remedy acts better or in low dilutions, functional remedial in higher dilutions. So some medicines are required to be act as a nutrition, and some medicines are required to act as a eliminations. So digestion process, based on this idea of the digestion process and the constitution of the body at that time, this idea came up. And sixth, he said that when based upon the retention of the carbonitrogenide constitutions can be cured by the higher potency. Friends, now let us see something about the status of the LM scale of the potency. Popularity of LM scale potency is still not very popular now, and primarily because of the historical reason. You must be aware that our homeopathic arena, they started, they heard about the LM potency only after the publication of the 6th edition, which was published very late, early in the this 19th century only. So it is neither Dr. Kent, neither Dr. Bonigesens had used the LM potency. So this is the historical reason. It remains hidden in practice. And understanding for LM potency appeared only after the publication of 6th edition of the Organism of Medicine. And earlier practitioners were not aware of the LM potency. It gradually gained publicity after the publications and experimentation like that. Smith, Kunjle, Vogel, Dr. R.P. Patel, Dr. Chaudhary, and Dr. Sankara. And myself also have converted entirely into the LM potency. Dr. Kent was not only an exponent of the medium and high potency, but was also the precipitate for generations for the high potency. And from 30th to 10th M potency, he says, will be curative power most useful in very sensitive women and children. From the 10 M to MM potency, all are useful for ordinary chronic disease in person not so sensitive. Then in acute diseases, the 1M and 10M potency are most useful. Now, see the Kent idea about the acute case. He was using only high potency, 1M and 10M. In the sensitive women and children, it is well to give 30th or 200 potency as first, permitting the patient to improve in general way, after which 1M potency and 10M potency may be used in the similar way. He further writes, when the simillimum is found, the remedy will act curatively in series of potency. Now he was in favor of going from high to the low. First you give the low potency, medium potency, 30 potency, then 200 potency, then 1. So he was using the series of the potency. If the remedy is only partially similar, it will act on one or two potency, and then symptoms will change and new symptom remedy will be required. So this is the factors influencing the selection of the medicines. The life which has traveling from within outside. We have to say the within outside. The medicines has to act from within outside, from inside to the outside. And when it is the direction of the Hering's law, this is the indicative of the Hering's law. It has to come from medicines. They start moving like this. The small GIF, you can understand, fully understand that what is the status of the low potency and the high potency, selection of the influence of the potency. This is very important message that I understood about this aspects. Now, factor influencing the, now let us see some practical aspect of selection of the medicine potency. Certainty about the remedy chosen. How much you have certain, how much you are aware that my medicines is correct. Then from where from which kingdom it belongs, whether it comes from the animal kingdom, plant kingdom, vegetable kingdom, or mineral kingdom. Then what is the age of the patient, the gender, male, female. Then what are the occupations of the patient and sensitivity of the patient, how much he is sensitive, very sensible man, good man, robust man. Then vitality, his strength and nature of the patient. So these are the factors that needs to be analyzed before we select the potency. Now, factors influencing the selection of the potency, type of disorder, where the disorder is, it is functional or pathological. Then severity of the pathology, what is the severity? Then acute or chronic nature of the disease. Then clarity and abundance of the mental symptoms. If the symptoms are mental symptoms are very high, it is very useful. Then why you want to, what type of the results you want? Are you want to cure the disease, or you want to make only palliations? Because in some cases, we need palliating. In the terminal cases, advanced pathology, where there is no cure is possible. So if it is meant for the palliative process, you have to use the different potency, and if it is meant for the curative purpose, you have to use for the different purpose. Then level of the proving. Now this is also important. Medicines are proved very widely and they are weakness in nature. Some medicines are half-heartedly proved, so symptoms are very limited. So when you draw a totality from these aspects, when the totality comes from the polychrestic of the medicines, it is very important, because you are getting the entire understanding about the medicine. But with the rare medicines, you have only the partial understanding. So nature of the drug and level of the proving is important. And then miasma of the patient. Miasma is not a difficult subject. It is just only the level of the patient, where if it is at the superficial level, it is soric in nature. If it is at the medium level of the life, it is psychotic. And if it is deep inside, where it will start degenerating, if the pollution will degenerate the life, that will be the syphilitic aspect. So the functional state, pathological state, severity, chronicity, and clarity, mental symptoms, and the level of the proving and nature of the drugs and the miasma are some of the factors that will help you, that needs to be considered before you select a medicine. Then other aspects are disease potential. Disease potential involves various factors. Value of the symptoms. What is the importance of the symptoms that you have? It is characteristic symptoms. It is just a common symptoms. Then nature and seat of the disease, from where it is. Then tissue affinity, from which part it is there. It is affecting your liver. It is affecting your stomach. It is affecting your heart. Then pathology involved. What type of the pathology has developed? It is the malignant type. It is the benign type. It is just a induration type, and then durations of the pathology and pace. So these are the criteria, very important, that we should keep in mind. Then sensitive and susceptibility is also very important. It is denotes sensitive means susceptibility means high, moderate, and low potency, and high sensitivity shows the higher level of the reactivity. When the patient is very sensitive, if you say the child is very sensitive, and how fast he reacts, and then the children who are very dull in nature, they don't have the reactivity. So you just can differentiate within the age group also. There are very dynamic, the patient, the child who cannot rest. He's always active. So definitely he has got the higher sensitivity. And then there are the dull type of the patients who have the susceptibility, who is not greatly affected by the surroundings. They have got the lower activity. Then miasmatic interpretations again is very important. Miasmatic means what? So it is Sora separate psychosis, but Sora represents only the physiological. Psychotic represents the changes, and syphilis represents the destruct. So from the way tissue starts getting destructed, that means it is the, so for the destructions, you have to think, select a medicine. For the physiological functions, you have to select a medicine, and for this. So these aspects are having to be kept in mind. Then similarity and degree of level, how much similar it is. Suppose you have selected, during your totality, you have created eight symptoms totality. So how many symptoms are, it is not the intense, whether the medicines are put in the low grade, high grade, or medium grade. The similarity, the exactness, that is important. Then suppression, whether the disease is suppressed to nature. This suppression is important. And there are many in present day era, you will find the patients coming from the allopathic conditions. They are basically the original symptoms, the natural symptoms are suppressed. And in homeopathy also, when you use the multiple medicines, many medicines at a time, it will have a suppressive effect on the life. Then type of the patient, which type of the patient is, his personality, his constitutions, his nature. So this type of the are the influencing factor that we have to keep in mind. Then now just to see the comparison between the low potency and the high potency. Suitable for the low potency is suitable for with the pathological changes and low vitality. And high potency is required, not suitable for the low or the vitality and pathological potency. So low potency is suitable for the lower pathology and the low vitality. Where similimum are only the general or prescriptions is on the particular lower potency. Similimum is based on the particular symptoms only, so you have to use the low potency. They go down rapidly in true similimum, where the susceptibility is perfect, higher potency are better. Then patient types, old, mature, prematurely old, low fertility, and old looking, sunken eye, and receding chins, they will require the low potency. And high potency, the young, intelligent, high, neurotic, highly vital will require the high potency. Then short duration action. You have to, how long the medicines has to, low potency are the short duration action. High potency, once you have given the potency, that in any potency, high potency, the action may continue as long as one prescription, the patient, we didn't read medicines for the years together. And low potency are always superficial in action, and high potency are deep acting, and aggravations are severe in the low potency, but in high potency, and this is the idea which made Dr. Henneman to think about the element potency. Mild, gentle. His idea was just get reminded with the FI number. Second, definition of the cure. How the cure follows? It must be gentle, rapid. Gentle, rapid. So, if there is a gentle action, and this gentle and rapid actions can be brought by the high potency. Then sensitive persons tolerate well low potency, but sensitive persons do not tolerate and develop symptoms proving. With the sensitive, you will see drug symptoms, drug proving will start. And suitable, this low potency is suitable for the acute diseases, but that is not the low potency disease with intense intensity will require the higher potency. And only high potency can penetrate to the deep depth of the old miasmatic situations and heal. So this is the journey between the high potency and the low potency. Now let us go into some of the aspects of this high potency and the low potency. Low potency, hypersensitive patients. Such patients react to perfumes, environmental factors like carpet, bleach, newspaper, etc., or people who react strongly to regular dosage of medications and vitamins, as well as those react to the strongly anesthesia. So hypersensitive patients who are very much sensitive, even the perfumes, after reading a newspaper, they will get excited and they will react violently. So they are highly hypersensitive patients. Then low elder patients, low potency. Then low potency patient has a chronic skin disease, especially when treated in past with cortisone, chronic eczema, or psoriasis, to name the common disease. Often the symptoms were controlled by cortisone. In this case, the dose should be minimum, drop instead of tablespoonful, and definitely not higher than 6 potency to start. These are the guidelines that I have observed one thing. Then low potency, strong pathology is there. They usually means he already has received a medical diagnosis and there is extensive pathological involved, like destruction of tissue, like in multiple sclerosis, Parkinson, formation of tumor, deficiency factors like in diabetes, hyperthyroid or Basidius disease, autoimmune disorders with destructions, asthma, etc. Also in chronic disease affecting the heart, brain, eye, pancreas and lungs, the low potency will be useful. Then in children, high potency is required in young children, babies, included as long as the previous conditions are not present. The choice of the high potency include ASD, ADHD, ADD, such type of the OCD diseases. So this mental sufferings, mental disease, they require the high potency and children. Potency is required in the adult with functional disease. No pathology has been shown, like vertigo, gastrointestinal problems, hypertension with no pathology, yet inflammatory process like Bell's palsy, etc. Or adult with only mental or emotional problems such as depressions, grief, lack of confidence, lack of motivation in life, timidity, and loss of meaning of the life. So they will require the high potency. Then patient under stress. If the patients are at home with the relationship, strange relationship are there, they will require high potency. Disappointments, who are worried, who are continuous in depressions, they will require the high potency. Then higher the sensitive, now this is the potentiality, this rule that you can keep in mind, higher the sensitivity, higher the potency. The more the high sensitivity there, the more higher potency you have to go. So the mental changes, high potency, physiological changes, medium potency, and structural changes, low potency. So these are some of the summary that we have taken from the different stalwarts and experiences that is being practiced in the homeopathic system of medicine. Then a spiritual plane, the patients with the spirituality, they will require the high potency. Mental plane, high or low medium potency. Then physiological, medium potency. And deep pathology, the low potency. So now I am coming to my own experiences. That means it is based on my clinical practices that I am practicing since, and because you may be aware that I am not giving medicines orally to the mouth. I use administration through the hair of the patient. So during the long journey using the classical homeopathy, and right from the my life, as inspired by my father, Dr. B. Sahani, I have a confirmed and strong follower of the single medicines, the dynamic medicines. And I use only single potential medicines to be strictly followed. And it needs, what I have understood, that it needs lot of patience, perseverance to wait and watch for the medicines to act. Only because of the impatience, we keep on changing the potency or the medicines. Patience is very much essential aspect for the medicines to act. Your patience, the patience of the physicians is more important than the patience of the patient. Patience of the physicians, after prescribing a dose or a medicine, he has to wait till the action begins. Even the medicine's action is wrong if it is delayed, because some medicines the action starts very quickly, some medicines start at the latter stage, and some medicines have got the action at more latter stage. So all these aspects, arena, are there, and you might have perceived and understood about the status of the life, and you can have an idea that in this status has to be kept in mind to develop the patience for waiting for the medications. Then what I feel is strictly adherence to the principle as given by our founder Hahnemann. After all the opinions has to be based on the first instruction given by Dr. Hahnemann. And always keep in mind, it is the patient who is sick and not the part of or his organ. This is the basic things, basic theme and the soul of the homeopathy. Patient is sick, not his part or organ. And then vital principles are the overruling factor for the sufferings. All the sufferings has to be understood in terms of the vital principle. And medicines indicated on the basis of single peculiar symptom must have correlations with the other presentations. Many of the students I have seen, they are in, they get very excited when they see one single drug for one single rubric. Mind it, they are very dangerous situations. You cannot prescribe on one symptoms only. You have to see that whether the other symptoms related to that medicines are present or not present. If it is not present, it will not act. I have experienced in my life. A patient is indicated by a single symptoms, however peculiar they may be. This is very important understanding that I have got. Now, let us come with some of the cases. A case of hydronephrosis. I saw this boy of 5 years age, where we selected phosphorus. I'm not going you how we selected, only to indicate the potency. So here in this presentations, I'm giving you how I proceeded with the potency. So I selected phosphorus in that case, and then we transmitted the medicines through the hair in 0/1 potency. This is the first potency. The patient responded well with a decrease in swelling and the urination flow. And it went well, but on observation slowing down of improvement, we increased to 0/3, which worked as much better. And after a month of continued progress, it seems to be slowing down. I went up to the 0/5 potency. And immediately after the 5 potency, 0/5 scale, there was a relapse of every aspect. And I tried to see whether I have to change for medicines, whether I have to antidote the medicines and think for a new medicine. But whatever analysis and attempts I made, I couldn't get that new medicine. Then I started thinking what to do at this stage. The patient was well with the 0/1 potency, 0/3 potency, and only after giving 0/5, the patient conditions started getting deteriorated. So I just decided to go to the previous potency of the 0/3. So immediately in the night I prescribed the 0/3 potency, which acted miraculously, and very next day all the swellings and edema were gone. So in this case, I learned about the appropriate energy level. What of this patient was 0/3, and we should not go ahead. When you have reached the high minimum, just slightly higher minimum that was spoken by Dr. Henneman, the medicine that we call the most medicine. So at this stage, 0/3 was the tuned medicines for this patient, and it didn't get it. And now this patient is still not having the relapse of the symptoms till I met him after several times in last. So this is the learning that the appropriate nature of the potency is important. Appropriate nature of the potency is nature. Then another case is about the liver cancer of a young man, and it was in 1990. He was 40 years age, and he was not because he was declared that there is no recovery. So he came to us for some relief in the pain. I selected arsenicum 0/1, and for him, and transmitted, patient started improving within a week and was almost free from all pain problems went away. Then I asked him to go for the checkup, but he refused, saying that now he is cured. I said, no, I repeatedly asked him to go for the checkup so that whether we see what is the condition of the liver. He said, no, doctor, I don't, and he left. He came only for 4 or 5 months, and then he didn't came. Then again, I just see it. Again, after 10 years, he came to me for the pain in the abdominal region, and I had almost forgotten him. He showed the prescriptions, and we got his file reopened, and after evaluation, I found the same totality. As such, I transmitted again 0/1, and his pain was and discomfort vanished within a week. In this case, I learned when we have identified the energy level of the patient, we should not go for the change of the potency. This is better understanding I have learned during my clinical practice also. And then in case of the epilepsy, in a adult male with frequent paroxysm of attack, we selected carcinosin, and we transmitted in 0/1. And within a minute of the administration of this medicine, there was a violent attack in our clinic. I got also afraid. The patients were in panic. Doctor, what has happened? But we just stopped giving the medicines and waited in the clinic itself for about 1.5 hours, and thereafter he went well, and we said now he has to go. He's okay. The case was followed for 2 years and never any attack was seen. So what we see, when the similimum potency are acute, are very exact, after a severe aggravations, there was a complete Herring's law, high aggravations followed by ameliorations. Aggravations followed by ameliorations is the law that has worked very nicely in this case. Then this is another case of the COVID-19 during the present online consultations. A male patient under our previous treatment telephoned in the evening about irritations, cough and fever. His cough was getting better after eating during the, he was also feeling helplessness. There was pain in the head with mild fever. And on the basis, we arrived at anacardium. Just see the anacardium. Cough, fever relieved. Next day, and we prescribed in higher potency, 0/6. This is the acute condition. So we prescribed in 0/6, and the patient was relieved. Next day, he is now free from such condition. In acute cases, starting with higher potency are useful. You see just see the repertorial results of this case, and you can understand how I selected the anacardium also. Then another case during the COVID, a lady patient, wife of a homeopathic doctor, he consulted during the evening hours. She was feeling filled with anxiety and confusion in mind with the new situation. Her main problem was the fever and the cough. We inquired about the other symptoms. Cough was with the irritations in the throat and constriction feeling was there. We arrived at the following rubrics and prescribed anacardium 0/200 potency because this patient was not with me. I asked the doctor to prescribe anacardium 0/200 potency. He asked, first I asked LM potency. He said, doctor, I don't have the LM potency. Then I said, go for the anacardium. So fever and cough was relieved very next day. Instant effects are observed with exact similimum as well as higher potency in the acute case. So this again you see the similimum that I got for the anacardium in this case, and in the previous case also the similimum I got in this way. In both the patients, the similimum came in a different manner, not in the same manner. It is only the similimum which is very important. Then another case, a young mother approached with a child who presented with the high fever. Child was helpless. Child was in the lap of the mother, irritable, and she was unable to find what actually it was wanting. But when she came out of the room in an airy place, it was feeling better. So now he was feeling better in the open air. So on questioning and observations, we observed the patient was better when washed with the water, and fever usually more in the night. Child was getting started as of a frightful dream, and then child used to get angered easily. Then I prescribed calcarea sulf in 0/7 potency. Fever became normal very next day. See the calcarea sulf, very important new medicines that has arrived. I don't fix up my mind with any of the medicines, and I also request you not to fix up your mind with any of the medicines. You just go for the totality and analysis, and you can get the better understanding of the medicines. So fever became normal next day. Child became as normal as before. Calcarea sulf is rarely indicated in the case of the fever. In this case, capriciousness state is important. Capriciousness are there in the chamomilla. Usually people think about the chamomilla, senna during the fever. But here, the chamomilla, along with the chamomilla and the senna, you will find in the repertory calcarea sulf is also there. So again, I am confirmed with the exact similimum with high potency brings instant relief in the acute disease. Then another experience of the child has a barking cough, and but has to cannot keep. He always do not want to remain. However, the pressure patient mother was making, the patient was not remaining in the house. He was always ran out from the house. Child was fearful, even with the coughing, and appeared as if no concern with it, told by the mother that it cuff between the cuff child used to eructate. This is important indications. Eructations during the cuff. It was not tolerating the child. Mother wanted to put him under the cover, but he threw it away. Then water also not tolerated. He was not liking that one. I selected Veratrum 0/6 and it was prescribed, and cough decreased next day and it got totally removed after that 3 days. So again here it is confirmed that exact similimum is important to bring the instant relief in the acute disease, and this is the way I selected Veratrum. Then another case of the dog bite. It was just when I started my practice, seated in my clinic in the evening, I was feeling bored with no patient. It was also raining, so patients were not coming to my clinic. A person entered into the clinic and asked about me. He then explained the purpose for seeing the patient who refused by one of the most senior cats of the town. He asked why he refused. He told that doctor has refused, saying that it was the case of hydrophobia after a dog bite and there is no remedy for it. He requested to give some medicines for at least relief. Realizing his situation, I dared at that time to see the patient. Then I called the patient inside the clinic. At first impression, it was full of blown presentation of the hydrophobia. Patient was demanding for the water. He was thirsty, and as he was feeling choking, and as water was given to him, he cried loud and he became fearful at the sight of the water. This is very important indications. I looked for the other conditions. I consulted our tree, and thereafter I selected the lycinum. I decided to prescribe lycinum in 0/3 potency. I transmitted the medicine through the hair and gave some placebo to the patient to be taken and report after 2 days. They went away, and I was wondering whether that medicines will work or not work. The patient didn't turn up. I thought that the patient might have died and might have left the treatment. But after a month, he himself came along with the person who attended him earlier. As I had seen him in such a distressed state, I was not able to recognize. I was told he felt better very next day and gradually recovered fully, and felt that now there is no need to report. So he didn't came up, and he was looking fresh, and sense of gratitude was there. Attendant wanted to get a treatment for himself, as such they had come. A great sense of satisfaction and confidence was filled with me. I still remember it was mercy of God to me. So just see, when the simillimum, right simillimum, only the dosage medicine, the zero potency, the medium potency that I consider was useful in this case. Then this is a young laborer and who was working in a building constructions work. So while lifting the brick, he was bitten by the black scorpion. Intense burning pain started at the point of bite in finger, which was gradually increasing to the upper arms. They rushed to me as a close neighboring clinic. I prescribed Apis mellifica in 10 potency at the time because I don't have the high. So at high, see, just the immediate bite by the scorpion, very painful. And Apis mellifica 10M transmitted to the patient through the hair and asked to wait in the clinic itself. pain started subsiding, and within a minute, and completely relieved with painlessness than painless and in half hour. High potency in intense acute pain act very fast. And this is my personal experience that I have observed with so many cases during the clinical practice. I am confident if you have the proper selections, if you have the proper appropriate potency, you can do a wonderful fillings. But for this, all the potency may be needed. No one potency, higher potency will meet the requirement of all cases all the time. This is the understanding that I have got from Genius of Homeopathy by the Stuart Close. We must be open in using selections among the range of the potency. It is not one potency, two potency, medium or low potency, but the range of potency, just like we are selecting the medicines from our Metra Medica, we have to use the selection of the potency procedure, and both will be required as a pre-essential part for the prescribing of the medicine. So with this quotation of human being by Einstein, is a part of the whole, called by the universe a part limited in time and space, experiences himself, his thoughts and feelings as something separated from the rest, a kind of prison for us. What is life? It is just a restriction of personal desire and affections for a few persons nearest to us. Our task must be to free ourselves from this prison by widening our circle of compassion to embrace all living creatures and the whole nature of them. How wonderful thoughts from this master, great inventor Einstein. Human being, if you remain limited with your thoughts, you cannot understand the universe. You cannot understand your problem. You cannot understand your pain. You have to open. You have to open. You have to develop a sympathy. You have to develop regions, your vision to embrace all living creatures. They are the beauty of the nature. So, and this is the beauty of your confidence. So inside, find a place inside where their joy and the joy will burn out the pain. The happiness is the remedy for the pain. Happiness, joy is the remedy for the pain. So giving is the highest expression of the potency. So our potency, the use of your potency, your learning, what you have learned, and how you are giving it to the patient will be the highest expression of the potency. So friends, thank you very much. With these thoughts, just I try to make bring you with this idea of the use of the potency and how I used and what I understood during my long journey of the homeopathy. If you have any questions, we may be asking right now, so you can put, but if you are not able to have put the question right now, you can send me an email on my email ID risdth@gmail.com. WhatsApp number is 943102062. So you can remain in contact with me, asking me about these things. So thank you very much. Thank you very much. And with this, I'm just closing this PPT. So thank you.
Thank you.
And
Thank you, sir. You must experiment and experience in every potency to find which one works well. Well said, sir. Thank you for your thought-provoking ideas about choice of potency. It is very much valuable and very helpful for all of us here, future homeopaths here. It is also very refreshed, and also it refreshed our knowledge on homeopathy and its practice. Thank you again, sir. For further proceeding, I call Dr. Karthikeyan. Take over.
Thank you, Dr. Ashita. Now we move on to the polling. The questions are displayed on the screen. The polling time is 1 minute.
Polling over.
It is time for speaker to answer your questions. If you have doubts, I request participants to put your questions on the chat box.
Polling over.
Sir, your question, sir?
I think there is a question. I think there is a question related to the hypersensitivity and what I told and what I have understood and what I have experienced. Hypersensitive means what? The patient who become easily affected by the surroundings. This is the understanding that we should keep in mind. Easily affected by the surrounding, the hypersensitive person, like taking cold very easily, get stomach getting bad, even after the slightest discriminations in the eating. So they are considered as the hypersensitive. And then hypersensitivity patient. Sensitivity means the patients who are emotionally, they have the emotional power is more than the intellect. They use the emotions in the primary level and intellect at the basic is buried beyond this. So they become angered easily, they are vengeful, they are excitable, they are very sympathetic. This type of the persons are sensitive. So both the hypersensitive and these cases, they will be requiring the high potency, not the low potency. The usual sense is that if the children require low potency, but in my practice, I have seen that children are very hypersensitive, and they are also the emotional aspects are more than the emotional aspect. So it is for them, children also, I have also given you the cases where I treated potency and I got good results. Then another question is regarding the 50 millisimal scale potency. I have just replied about the 50 millisimal and I used about the 50 millisimal is the ultimate potency that you have to use. This ultimate means because Hahnemann has given you the final instruction. So just I will ask you a question. If you have the old model TV, black and white, if you have the new model TV, and if you have another latest version of the TV, what will be your choice? definitely you will go for the higher level. So you take this LM potency as the higher level potency, and the most ultimate potency of Dr. Henneman is. And if you get insight into this higher using this LM potency, you will understand the depth of the homeopathy, and you will come more closer to the spiritual aspects of the medicine.
Okay. Sir, your next question.
Yeah.
Which potency to be used in comatic or ICU patients?
See, again, here the questions are related to like the patients who are in the bedside prescribing. Now we have to see the cases now. Just I am reminded with a case where the fever was not going away and it was hospitalized. And the patient was, many doctors came. But when we saw, it is the case of the Dr. George Mitchell-Cott, when he saw the patient, he went.
Okay. So next question. What should we do in case of violent aggravation with 0.1
he has
potency?
not. Ashika, please wait. He has not. Sir has not completed. He's got some network issue.
Okay, sir. Okay.
Dr. Sahani sir, we are not able to hear you. Maybe your network, you have a network issue. Participants, kindly please be patient. I think Sarah's got some network issue. We'll be connecting him soon. So please be patient. Thank you for your patience.
Sir, your mic is muted, sir.
Yeah, rain has started here now, so that's why network went away. And
yeah, got it, sir. Yeah, network problem. Yeah, Harshita, continue பண்ணுங்க, please.
Sir, your next
I
question, sir.
got connection from the mobile data, and I hope that it will continue. Rain is going on.
Sir, your next question from Dr. Vinita Singh. In case of violent aggravation with a 0 bar 1 potency, how to proceed, sir?
See, this is beautiful questions that you have asked. When there is a violent aggravations from the low potency, there is a understanding that you go for the, and if you feel that the medicines is not wrong, mind it, if the medicines remains the same, and if you feel that the medicines is not wrong, in that case, this 0 by 1 potency, or suppose you gave that 30 potency, it will be antidoted by the same medicines at the 200 potency. This is very good things that we can get. High potency, the law idea is that high potency is antidoted by the low potency, and low potency is antidoted by the high potency. The case that I gave you about the hydronephrosis, where I prescribed phosphorus 0 by 3, it was the patient was better, but when I went up to 0 by 5, the patient conditions aggravated. In that case, when I went back to 0 by 3, the patient conditions improved. So this indicates that high potency is antidoted by the low potency, and low potency is antidoted by the high potency. Yeah. Next.
Yeah. Thank you, sir. Next question by Dr. P. Chiramanan, sir.
Yeah.
How you administer 50 millisiemens scale of potency? How you advise them to take medicine?
My personal way is that I take one small globules that is very tiny, less than a mustard seed, size of the mustard seed. I dilute it in a 1 gram file, 11 potency, 1 gram file, and then I give the strokes. And because I am using the transmission board, I put the hair, I insert the hair into it and keep it in our place. So this is my way. But what I feel, if you want to give it orally, you can just dilute 1 drop, 1 globules in a cup of water, half cup of water, normal water, and then you can give repeatedly for in the first stages till the action begins. Till the action begins. This is one way. And then another experience that I heard about Dr. Farooq Master, he is using the 7 bowls, where he put water from medicines in 1 bowl, then in the next bowl, first medicine from the first bowl, and then next dose from the second bowl, and third dose from the third bowl. That means he put some water in the second bowl filled with water, and from there he gives the patient. So this is there are some diversity in the use, but whatever it may be, using the potency, LM potency in diluted form. Instead of pills form, using the potency in a diluted form is more useful. So repetitions and the dosage that needs to be considered. Yeah.
Yeah. Thank you, sir. Next question. Which potency to be used in comatic or ICU patients?
If it is somatic in nature, that means where the pathological development is more, and they are in the ICU or in bedridden. In that cases, you have the 2 approach. If the condition is almost vitality is almost gone, in that case, you have to start with the high potency. If the vitality is still there, but with the higher pathology, you have to start with the low potency. So in elderly patients with the advanced stages, I usually go for the low potency, and then we gradually go up. Yes.
Okay, sir. Your next question, sir. Can you please share a note on plusing potency?
Which potency?
Plusing potency.
Plusing, yeah, this is very, this good idea is also there, just similar to the Farooq Master experience. It was introduced in the Organon of Medicine, narrated by Luke D. Sepper in the blessing of potency, and I also use it in my practice. What I do, suppose I have selected 0 by 3 and I want to go further, then what I do, I just simply throw away all the water from the pipe and add fresh water, and then I give it. So this is 1 plus. Then again, after, if the medicine cement, so this is a gradual increase of the potency, and this is working very well. I am in most in where when as long as the patient is in of the same totality, same level, he has to be kept in the same potency, but with slightly gradually going up. So this is the plusing idea. And it is also, if you want to read more on it, you can go to the Luke de Sepper. But it is my personal experience also that with the plusing method, the system is working very much well.
Thank you, sir.
Yes.
In transmission of drug via hair, how do you use mother tincture, sir?
See, this is some idea is that for transmission means what? What you can transmit. What you can transmit? You can transmit only the dynamic. You cannot transmit the mother material. What is about the mother tincture? Mother tincture, they have the crude form. So the crude aspects of the mother tincture cannot be transmitted. It is our experience. You may make experimentations because there are some idea confusion about the and some controversy about the mother tincture, because some mother tincture that is available, they are very dynamic in nature, like all the crude substances, and when they are titrated, which cannot be put to there only remains even after the titration the material remains, but the dynamicity is created. And in like the medicines that we obtain from like X-ray, what is the mother tincture of the X-ray? The first exposure that we have kept into the water in the vehicles, and that constitutes. So what is X-ray? X-ray is energy, type of ray, which is high potency. So it can be transmitted. So some type of the mother tincture can be transmitted, and some type of the mother tincture which is exactly crude, where only matter and is there. I feel that they may not be, but still with the mother tincture, at least some potency is gained. So more experimentations are required when you are using this concept.
Next
Yes.
question from Vidarshana Sri. Please explain about transmission of medicine through hair.
In my last lecture also, I had given this idea, and I am the practicing only my way of practice is transmission of medicines from a distance. That means my understanding is what is homeopathy. Homeopathic medicines are those substances, those medicines which cannot be digested. It don't require digestion. It don't require any methodological or physiological functionings. Is not involved. So, and with this dynamicity, so and when you think that the homeopathic medicines are dynamic, you are just think about what is the property of the dynamic. What is meant by dynamic? Dynamic means getting affected from a distance also, or affecting others. If the medicine is dynamic, it affects by just simply by making the change. So, and it can be transmitted also, it can be broadcasted also. All the dynamic property are being utilized in different arena of our society. We have the mobile phone, we have the remote controls, and there are many other things are there. Benevesto has also experimented, and he said he has observed that the things can be transmitted from a distance. So with this idea, applied idea of the distance property, effectiveness of the distance, it is transmission medicines work. And we have started, my father started working at, and now even after his death, I continue till today. In my practice, I never use oral medications. I always, even in the acute cases, emergency cases, and all type of the cases, I am using only the transmission mode of system. This is basically a physics work and understanding of the mode of administration of the medicine. And hints was given by Dr. Hahnemann also in his Organon of Medicines. In the last few FOIM, like from 283 onward to 291, you can see his thoughts, wandering thoughts of the Dr. Hahnemann. He was of different opinions he had in his mind, whether to give the medicines orally, whether to give medicines through the olfactions, whether it had to be applied. Then he tried to compare it with the mesmerism also. What he did, he said, writing about the mesmerism, he said, how the mesmerism works. And here he made a note that mesmerism was just like the homeopathic medicines. So mesmerism is just a distance mode of administration, where positive and negative impacts are given. So this way, Hahnemann also was thinking, might have been thought, I don't say he was thinking, he might have thought about using the medicines from a distance. And in many other system of the medicines, right from the beginning, the thought process are very important also, the meditations and other things. And they are unknown energy. They are unknown energy. But our medicinal proved medicines are known medicines. We have the definitive proving, we have the definitive idea. So better using these known medicines for the distance administration rather than waiting for the administration or the raking. This method is more useful, and I think most appropriate mode for application of the homeopathic medicines. Most appropriate method for application, administration to the homeopathic patient. Yes.
Thank you, sir, for patiently answering the question. Gratitude puts a smiley face on everything it touches. So now, I request our lecturer, Dr. K. Swaminathan, sir, Department of Organon of Medicine and Homeopathic Philosophy, to deliver the vote of thanks. Over to you, sir.
Thank you, Dr. Karthikeyan. I first of all thanks the God Almighty and our speaker, Dr. M.K. Sahani, sir, for your valuable experience and telling about the potencies from the stalwarts. And I also thank our CEO, Sai Prakash Liyomuthu, sir, our CBO, Mr. P. Satish Kumar, sir, and our beloved principal, HOD, Department of Organon of Medicine and Homeopathic Philosophy, Dr. P. Cheramanan, sir, our webinar coordinator and program organizer, Dr. Jerin, sir, our comparing team, the budding doctors, Dr. Arun, Dr. Hashita, and Dr. Karthikeyan, our technical support, Mr. Srinivasan, IT Department, Sairam Institutions, our poster designer, Mr. Jambunathan from Trust Office, and I thank all the teaching staffs, non-teaching staffs, medical officers, hospital staffs, interns, and my dear students for making this webinar a successful one. Thank you, everyone.
Thank you, sir. Thank all the participants of today's session. Now, I'm ending this session with a small quote stating, welcome the challenges. Look for opportunity in everything to learn and grow in wisdom. I wish, may every sunrise hold promise and every sunset hold peace. Thank you, one and all.
Thank you. Thank you very much, sir. Thank you.
Thank you. Thank you all.
Thank you.
Thank you, sir. Thank you, sir. Thank you.
Thank you.
Wonderful session, sir.
Yeah. Bye, sir. Bye.